Do you ever find that you're constantly tired? You have brain fog, you have problems with your breath, as in you get out of breath a lot, not that it stinks or anything. You have that loss of smell, so if it did stink, it wouldn't matter that much anyway. You have muscle and joint pain, you have headaches, you have sleep problems, mood changes, gut issues, all these sorts of things. Maybe you get dizzy a lot, maybe you suffer from lightheadedness, or you have blood pressure swings. These are all things that could be linked with long COVID. And there's an interesting study that came through by Professor, hopefully I don't butcher his name, Professor Sergei Osterjic from Norway. Hopefully that's the right pronunciation. And he's an author of 250 scientific papers. He has 15 book chapters and books in his name and holds 8 patents. Yes, I have got my notes here. And patent applications in the UK, US, EU, and in Japan. So he's kind of a big deal. And creatine, that's usually the thing that people shout, have you been on creatine? When they give them the old muscle pose. And I was actually told once back in the day when I first started out as a little guy going to the gym, that creatine was a steroid. It's not. It's a naturally occurring substance made up of 3 different amino acids. Now these amino acids are arginine, glycine, and methionine. So it's a natural substance. It's produced in your liver, kidneys, and in your pancreas, and it's found in food, mostly red meat and in fish. Hence why vegans usually will want to supplement a little bit more. But should we all be supplementing? And is it going to be good for long COVID? Not just long COVID, but for brain function overall. Spoiler alert, I've got my mum in her 70s having creatine for brain function. That's what I want to say about this. Now, creatine is a thing that helps support the body by recycling a thing called ATP, adenosine triphosphate. That is your body's primary energy source. It helps your brain function. It helps your brain function particularly in white matter and neurons when you are under stress. It's known also for helping support muscle function, strength and recovery. We probably could have told you that one just from seeing it sold as a sports supplement. And it's a strong antioxidant, reducing the oxidative stress that you get from, life. So that has been seen in both the brain and in your muscles. So as I say, it's not something that people generally link with brain function. They more link it with that jacked guy down the gym. But there was this study by Dr. I've forgotten his name again. Dr. Osterjic. There was this study by Dr. Osterjic. And it was a double-blind, placebo-controlled, randomized trial. If you're not from the academic background, basically what that means is that the people giving it don't know what they're giving, and the people getting it don't know what they're getting. And then some people were given it, and some people were given another white substance, make of that what you will, that had no active ingredient. I know it sounds like the UK government sort of thing that they would do, but it is actually a known thing in science. This stops people having expectation bias and also observer bias. Now, this study, it was done on 12 adults. 12 adults that were all suffering from post-COVID fatigue syndrome. If we say COVID right now, do we still get hit by the algorithm? These 12 adults, they were given 4 grams of creatine for 6 months. So not a really short-term thing, but short enough. The creatine group had some massive improvements. These improvements were that their muscle creatine, as you would expect, from going from nothing to having 4 grams a day, was increased by 15%. But their brain creatine went up by 10 to 12% on average, especially in the white matter that's dealing with stress. Their fatigue went down, their symptom severity, so their muscle aches, their body aches, their joint aches, their headaches, and their breathlessness went down. And their cognitive clarity, their brain function, their brain fog went, their cognitive clarity went up. All at the same time, no side effects were observed. So it's a pretty powerful thing to look at. It's not just for building muscle. And the mechanisms of action, that was seen here, as we said, ATP recycling to support your energy production, glutamate regulation, which means that it's helping your neurotransmitters balance, essentially. Now, there was also, as we said, antioxidants and anti-inflammatory actions, the oxidative stress that life throws at us, and even more so if you've had long COVID. And there was brain tissue recovery, which is super, super powerful, because don't we all want our brain to recover quicker and more effectively? Why does this actually matter? Well, post-viral fatigue syndrome, PVFS, and long COVID are energy deficient states. Not to say that it's been on too much of a calorie deficit or track your macros or any of that rubbish, but it's an energy deficient state, meaning that your body isn't being able to get the energy to where it needs it to be able to use to feel good. So low brain and muscle creatine levels will contribute to that persistent fatigue, brain fog, and body pain. The creatine replenishes tissues, and it may actually offer a neuroprotective role, meaning that your brain is going to be protected from more oxidative stress and more damage that comes from what life is throwing at it. So these results pretty certainly will support its use. In other studies have been shown on chronic fatigue, things like fibromyalgia, and as in here, COVID-related brain dysregulation, post-COVID fatigue syndrome. However, there were some limitations with this study. And it's always good to note that when you look at studies, when you read studies, we can see the good things. And many times we see the good things come through on social media, and these limitations, unless someone just wants to just straight up criticize the study, aren't really thrown out there. These limitations are that it was a small study. So there were only 12 adults there, and they were relatively young. I'm still young at 39, going into my 40s, right? But they were a young age, an average age of 31, and there were only 6 months of data. However, these results were very, very promising, especially given that there weren't any adverse side effects. And it was strong. The effect was strong given the sizes. So let's look at the actual takeaways. If you're a practitioner and you're looking to get this in your clinic, then maybe putting 4 grams a day of creatine into your client's protocol is safe. It's low cost. Creatine monohydrate, it's a basic supplement. You don't need to get these fancy branded marketed ones. Please don't get the gummies, but don't be thrown by the gummies and all the additives that are in there. Get creatine monohydrate, the basic white powder. I just said to get basic white powder on social media. But anyway, it's low cost and it's effective for fatigue, brain fog, and breathing efforts. Make sure that people are getting a minimum of 1 gram a day, especially if people are vegan, and also for recovering patients from long COVID. But I would honestly just try and push closer to the 4 grams, 5 grams a day. It's easy to do. If you're getting 1 gram, you can get 4 to 5 grams in there. And it may support your brain white matter recovery, not just your skeletal muscle. Now, what we do need to recognize is that this whole aspect of creatine being just for athletes, being just for people that strength train, first off, I feel everyone should be doing some type of resistance training. It is one of the probably the number one thing that is going to help you with aging and slowing that down, given that one factor that will dictate your risk of death is going to be getting up out of chairs and your leg strength. So strength training should be pretty much for everyone. But creatine isn't just for athletes. Long COVID symptoms, it pretty much could be a starting point for where we want to look. Although Big Pharma can't monetize this yet, so maybe we won't hear much about it. And I'd take it, long COVID or not. As I say, pretty much everyone should be taking some form of creatine. As I say, even my mum is using it. So there you go. If you're looking for specific individual support, whether it's to support your body after COVID and you're suffering from long COVID or the symptoms, or you just want to generally feel better and start to thrive and optimize your health once again, drop me a message and we can look at giving yourself a personal, individualized plan to help you on your journey. If you would rather just go to the website, you can do an optimal health test completely for free. Go to www.optimalhealth.com ojayhealth.com/optimal. I look forward to speaking to you in the future.